Good morning, guys. Now we'll go for the anesthesia in the Aiims. Quick revision. First question: the intubated patient in the ICU becomes violent, pulls out endotracheal tube. Which is the next step? Yes. For that, you have to read the option. Remove the tube and looks for the spontaneous breathing. Yes, you should do this one. Remove the tube fully and bag and mask. No, you shouldn't. Neither to re-intubate nor do the back physiotherapy. So option is 1A. Which of the following drug used for the IV induction of anesthesia? Dexmedetomidine, lorazepam, neostigmine, bupivacaine. Here both option A and B are right, but we'll go for the lorazepam. Third question: what is the correct sequence? We have to see the patient response, then call for help, then check the carotid and start the CPR. Next question, fourth number: mask that can deliver maximum oxygen. Here you can see nasal prongs, oxygen mask, venturi mask, face mask with reservoir gives the 100%. So option D. What is the recommended duration of the pre-oxygenation? Before pre-oxygenation, because we have in our trachea the dead space volume, so for that 3 minutes pre-oxygenation is required. Next question: least susceptible fibers for the local anesthesia. It's C fibers. Color of the 22 gauge IV cannula: it's blue, pink is 20, gray is 16, and green is 18. Next question: which of the following is the considered balanced resuscitation? Giving colloid and custodial 1:1, no. Maintaining pH by ensuring acid-base balance, no. Maintaining permissible hypotension to avoid bleeding, yes. The next question is the during resuscitation of a septic shock patient, NORAD is given. How would you assess that the patient is responsive? Yes, it will increase the BP. So option B is right, increase the mean arterial pressure. Next question, 10th. Hey, this is the lumbar puncture needle. All of the following are true regarding procedure except. Here you are asking the exception, so read carefully the option. Absolutely contraindicated in coagulation disorder, might be. Done in lateral recumbent position, yes, it's right. Bevel of needle faces upwards, obviously right. Breathing holding is not required, also true. So it's relatively contraindicated in coagulation disorder. So option A is right answer. Next one is the Aiims, November 2016. A chronic smoker underwent his laparoscopic abdominal surgery under general anesthesia induced by the fentanyl and propofol. ETCU2 graph is given intraoperatively. Ideally, it should touch the baseline, and then it would be of the endotracheal intubation. So among all the four options, it's best the C. Next is the calculation that we'll do the later. Next question is the why 100% oxygen can be given to the patient after recovery from the N2 effect. No, it's not the second gas effect, it is just because of the diffusion hypoxia. The next question is the best route. Wait a minute. Best route of administration during the resuscitation of the neonate. Obviously it's umbilical vein. Then on giving epidural anesthesia, xylocaine and epinephrine was injected. Within 3 minutes the patient had hypotension, and it's just because the drug is given in the subarachnoid space. Next, during laryngoscopy and intubation, which of the following is not performed? Flexion of neck, done. Extension at the head occipital joint, obviously done. Laryngoscopy lifted upwards, lowering over the upper incisor, no. It will break the teeth. Last option, in the straight blade, laryngoscope epiglottis is lifted up by the tip. Yes, it's right. So option is C is correct answer. That's not performed. A non-responsive patient is brought to the emergency. Just like question number 3, we have to check for the responsiveness, then call for help, then check for the carotid and start the CPR. So option B is the correct. What is the ratio of the chest compression ventilation for all ages done by the single receiver? It's 30:2. Next question: all of the following neuromuscular junction except the dental and sodium is the answer. It doesn't work on the neuromuscular junction. Then allergic reaction occurring during the immediate perioperative period due to the administration of the it's local anesthetic, the neuromuscular blockade. Next option is opioids and induction agent. Here in this question the correct answer is neuromuscular blockade. 20. The next question is, which of the following is not true regarding the rapid sequence intubation in a cardiac patient? Read the option. Simultaneous administration of induction and neuromuscular blocking agent. Next, pre-oxygenate the patient with 100% for 3 minutes before intubation. Done. Induction should be done with thiopentone and succinylcholine for the muscle relaxant. Required pressure is applied till endotracheal tube has been secured with off. All the options are quite correct. Just one thing, in spite of thiopentone is thiopental, that is used as the induction agent. So option C is the answer. Next is the Bizold-Jaris reflex. Because 46-year male with the severe convert blockage, 12 BP awakened by anesthetist. After 10 minutes of the administration, BP dropped to 72 by 44 and heart rate also down. Level of block was found to be T6. It's just because of the Bizold-Jaris reflex. Next question, the sevoflurane vaporizer can accurately deliver the dose of an anesthetic agent which resembles it is in which category? It's vapor pressure. Next question, the relation of age. As the age advances, its required MAC is decreases. So option in neonate, infant and adult. Where is the option? It's B. A drug that undergoes a Hoffman elimination at trachurium. That's why it's safe in using in the kidney failure or CKD patients. Again, these are the importance that we do in the internship. The patient with the diarrhea and severe dehydration requires rapid infusion IV fluids. So we need a large pore cannula. As the number advances, the cannula will be smaller. So it's gray 16. Again, in case of massive bleeding during surgery, we need 16 gauge or 14 gauge. The next question is, the patient was in surgery when following capnography was noticed. What is the next appropriate step? Here it's just touching the baseline. It's just the inappropriate muscle relax. So we need to do the administer skeletal muscle relaxation. Option A is correct. This is the LMA and we put the tip of the cuff above esophagus. Next, you all know that the oxygen cylinder color is the gray body, white solder. Option C. Ideal site for measuring temperature during anesthesia. Ideally, it's the tympanic membrane. However, it's not used, but ideal condition is asked. So answer is the tympanic membrane. We use rectal or oesophageal temperature. Oesophagus is quite mostly used. Next question is, the pregnant female with the placenta previa, bleeding and systolic BP 85, induction and maintenance for cesarean section. Its BP is down, so ketamine followed by intubation and GA is the answer. Ketamine is safe in the CVS condition. This is the bone marrow biopsy not its aspiration needle, lumbar puncture. It's lumbar puncture needle, so 25 gauge lumbar puncture. Answer B. Which anticholinergic drug most commonly used pre-anesthetic medication? We all know glycopyrrolate. Next, which structure pierced causes first snap or resistance during epidural anesthesia or lumbar puncture? We all know it's ligamentum flavum. Without option you can answer. Yes, it's Macintosh laryngoscope. Which of these in the May 2015, which of these anesthetic agents is contraindicated in a patient with the coronary artery diseases with pulse rate 48, low BP and decreased MI? It's dexmedetomidine. Next question, which of the following muscle relaxation can be used in a patient with the high bilirubin and serum creatinine? It's Atra. can check answer later also because it's safe. Here you can see the serum creatinine of the 4.5, as you know, is go for the Hoffman elimination. So during Hoffman elimination and by a liver, so it's no need. If it is serum creatinine is more than 4 or 4 and 5, it's safe. So answer is etc. Which anesthetic can cause pain? 3 are the painful: PET, that is the propofol, etomidate, and T, not thiopentone. Guess what? Till now we move forward. Which of the following combination can be used for the daycare surgery? Everyone knows that remifentanil, midas, and propofol is used. Again, question number 41. Which other daycare surgery? It's propofol, which is painful also. The names Bethune and Bracken associated with, yes, you have to remember this name, indictidal capnography. Again, for the eye care surgery, using propofol as the IV anesthetic agent and succinylcholine as the muscle relaxant. Recovery from the anesthesia was uneventful. However, the patient complains of pain in the muscles. Here is the twist. Mostly answer goes to the propofol because of the painful. But here they are saying that is pain in the muscles and after recovery. So it's just because of the succinylcholine that was given. Which of the following is the circuit of choice for spontaneous ventilation? Mapleson A is for the spontaneous and D for the controlled ventilation. Now the question is, all of the following are methods for improving oxygenation using a ventilator except low tidal volume, high PEEP, yes it's done, prone ventilation also help, high frequency ventilation will also help, but not the ECMO, that is the extracorporeal membrane oxygenation, it will not help you. Just 5 questions, guys. A patient head injury, intubated, ventilated, which would be the ideal mode of ventilation? As he cannot do the spontaneous respiration, so the volume should be controlled. So options A, C and D. Among this, CMV, controlled mechanical ventilation. Then what is the appropriate size of LMA in average adults weighing 50 kg? It's 3. At supramax concentration, anesthetic led to the shift of the EZ, that is theta to delta waves. You have to remember this one. The plane of the surgical anesthesia during anesthesia is defined as loss of consciousness to the onset of the respiration. No, its answer is from onset of regular respiration to the cessation of spontaneous breathing. And for 47 it's 4. That is the appropriate size of the LMA for 50 kg adult. The next question is the 50. Which of the following drugs does not affect the absorption and secretion of the cerebrospinal fluid? Here the answer is the nitrous oxide, because it does not affect the CSF production or absorption. Again the same question, which of the following anesthetic agent is a contracting epileptic patient, which is safe in the CVS but not here? It is ketamine. Midas causes all except, yes, it causes the anterograde amnesia but not the retrograde amnesia. It causes tachyphylaxis during high dose infusion, decreased CVS effect as compared to the propofol. So answer is B. The next question, during the CPR most commonly refractured, it's mostly the 3 to 5. However, in the left side it's 2 to 7 rev and 2 to 6 rev on the right side. The next question is lithium should be stopped 1 day before surgery. So guys, enjoy and all the best for the Aiims paper.